Good morning, and I'm really excited to talk to you this morning. So we're going to be talking about the seasons of myeloma. Now, I'm from Houston. We don't really have seasons. It's either like super hot or hot. But I did grow up in Wisconsin, so obviously very familiar with the seasons. So we're just to kind of lay the groundwork, right? There's so many different treatment options. So yesterday was actually my 20th anniversary of starting at MD Anderson as a baby nurse practitioner in myeloma. And over the last 20 years, it's just been absolutely amazing, all the different drugs that we have now for myeloma. It's really just mind-boggling if you begin to think about all the changes that have happened. And there's drugs that we used to use that we don't even use anymore because we have so many better options now. So just to kind of talk a little bit about the different phases of stem cell transplant, there's 3 different phases, right? We have the beginning phase where we're, making sure that you've responded to treatment, we're making sure that we have insurance approval, and then during this time, we're collecting stem cells, right? Then you move into the next phase where you're gonna get the high-dose chemotherapy, you're gonna get those stem cells that we collected back, and then waiting for engraftment. And during that time, you may be in the hospital, you may not be. You'll be getting growth factor support, and we'll just be helping your body to recover from that high-dose chemotherapy. And then we have the post-transplant period. During this time, it's really about helping you to get your strength back, helping you to get your appetite back, and then about 3 months post-transplant is when you'd begin your maintenance therapy. And then we have CAR T, right? And so I know Dr. Dispenseri has already talked about CAR T and kind of the process, but just to kind of, do a brief overview, once your doctor has determined that you're a candidate for CAR T and insurance approval has been obtained, then you're gonna have those T cells collected, and then they're gonna be sent off for manufacturing. And during this time, you may receive what we call bridging therapy. So bridging therapy is when you're on a treatment to keep the myeloma, at bay while we're waiting for those T cells to be manufactured. And then you'll come into the hospital, you'll receive those T cells back. And for the next 30 days, you have to stay near the CAR T cell center. And part of that time, you will most likely be in the hospital to monitor for the effects of CRS and neurotoxicity. And then about 30 days post the CAR T is when you'd be able to go back home. But during that time, you're still being monitored by your local physician. And you can't drive for 8 weeks, unfortunately. But generally speaking, it's a one and done, right? But another approach is bispecific antibody therapies, and so Dr. Dispenseri also talked about the mechanism of action for that. And so we have 2 targets right now, right? We have got the BCMA, and then which is B cell maturation antigen, and then GPRC5D. And so they work similarly where we have the bispecific antibody that's binding to a target on your T cell called CD3, and then it's binding to the marker on the surface of the myeloma cell. And so we have 2 BCMA therapies. We have teclistamab and elranatamab, and then for GPRC5D, we've got talquetamab. And so the unique side effects with CAR T and bispecific therapies is going to be the cytokine release syndrome. And it's common, but it's often mild, and it's manageable. We know how to manage CRS, right? But you do need to be monitored. So we're going to be monitoring you for fever, headache, shortness of breath, confusion, nausea and vomiting. And then we also have the neurotoxicity. And so if those of you who've had CAR T or bispecific, I'm sure you probably got really irritated by being asked the questions, where are you, what year is it, right? All these different questions, writing out this sentence, to make sure that you're not having any changes in your mentation, right? Because we want to be able to catch that early so that we can start intervention to help prevent more severe neurotoxicity effects. So now we're going to spring into managing some side effects. So what I always tell my patients is, I can't help you if I don't know what side effects you're having, right? And I find that a lot of times patients like to minimize their side effects because they're afraid of having dose reductions, right? But what we know is that when patients' side effects are being managed, they're able to stay on therapy longer, even if we have to reduce the dose, right? And so it's really, really important that you communicate to your healthcare team, because we can't help you feel better if we don't know that you're feeling bad, right? Unless you have a caregiver that uses their hand signals behind your back during the doctor's visit to say that there's a problem. And so side effects of treatment can cause GI symptoms, it can cause low blood counts, it can place you at risk for infections, it can place you at risk for blood clots, neuropathy, fatigue. And so we really need to know proactively. And it's helpful if you keep a symptom diary, like keeping a journal with the dates, so that, because sometimes there are certain side effects that are very predictable. And so we can then look at that journal and kind of help to do some prevention, right? So, I always say that if we can prevent something, that's the ideal situation. Now, steroids, it's the drug that we love to hate, right? I would probably say that of all the side effects that patients experience, it's the steroids that cause the biggest problems, right? And so it can cause irritability and mood swings. And so that can be really difficult, not just for the patient, but also for the caregivers and family members, right? And again, we need to know if that's happening, because we can't help that if we don't know that that's going on. It can cause changes in vision, cataracts, it can cause muscle weakness. And so one of the things I always tell patients, it's really important that you're getting out and doing some sort of physical activity. It can increase the blood pressure, it can cause fluid retention, which can cause swelling. And it can cause some insomnia, right? And so one of the things that you can do for the insomnia is I usually tell patients, once you take your steroid dose, kind of keep track of when you start to feel the effects of the steroids, because there's some patients, they feel it right away. They're like, okay, within an hour, they're ready to go and take on the town, right? And there are other patients that it can be delayed. And so if you're one of those patients where it's delayed, sometimes you can actually take it right before bed, as long as you're taking it with food, because then it may allow you to get some sleep before you start getting the revved up feeling. It can cause stomach bloating, it can cause heartburn, and so again, you want to make sure that you're taking it with food. Sometimes we'll put you on a medication called Pepcid to help minimize that risk. It can cause weight gain, and I think out of all the things, another problem, right, is you get this famished feeling, right, like 2 o'clock in the morning, munchies. And so I usually tell patients, get rid of all the junk food in the house so that you're not tempted at 2 in the morning, because it's probably a little bit harder to go out to the grocery store at 2 in the morning when you're hungry. And it can increase the blood sugar, and if you already have diabetes, you're going to need changes in your insulin or your diabetes medications. So infections can be really serious in myeloma, so particularly with some of our newer immunotherapies. So it's really important that you're doing what you can to help minimize your risk, right? So doing good hand washing is super important. Making sure that you're not around people that are sick. Making sure that you're staying up to date on all of your vaccines, right? And then also making sure that you're taking your supportive medication. So you may be on something to prevent shingles. If you've gotten CAR-T or bispecific, you may be on some other prophylactic antibiotics. So it's really important that you're taking those. And then also, if you have a fever greater than 100.4, or if you're having shaking chills, to go to your local ER, to your healthcare provider as directed. And we have medications that can reduce infection risk. So some of you may be on shingles prophylaxis with either acyclovir or valcyclovir. You may be on prophylaxis with levofloxacin as an antibacterial. You may be on something to help what we call PJP prophylaxis. So PJP is a certain type of pneumonia that can arise in patients who are immunocompromised. And so you may be on that after transplant, and then you also may be on that if you have had CAR-T or bispecific. And then making sure that, if you are up to date on your COVID-19 and your influenza vaccines. We're coming into flu season again. So, your flu shot starts now. So if somebody asks you, have you had your flu shot this year? They're talking about like from now going forward, not like since January. Because the flu vaccine comes out like August, September. And then you may be getting IVIG, which is basically IgG antibodies. So it's an infusion that we give, particularly in patients whose IgG level is less than 400. And then if your bacteria-fighting cells, we call that your absolute neutrophil count is low, we may give you a medication called GCSF to help bring up those white cell counts. So you may be receiving that. Other side effects, so with some of our drugs, particularly with our bispecific talquetamab, we can see some unique side effects. So it can cause dry mouth, it can cause some taste changes. And so for the dry mouth, making sure that you're staying adequately hydrated and that you're avoiding like hot beverages, but also making sure you may actually have something called thrush. And that is a fungus that can come up on your tongue and in your mouth. And then there's some dexamethasone oral solutions that can be helpful. As far as dental care, making sure you're doing good hygiene. You can also use some saliva substitute for the dry mouth. That can be helpful. And then for some patients, because they're having dry mouth, they can have some difficulty swallowing. And so making sure, I usually tell patients like to have something to drink before you're chewing food, before you're eating something that is likely to cause some problems with swallowing, so like bread or meats or something, making sure that you've really lubricated your mouth. And then because you're having the taste changes and because food isn't really tasting as well, we can see some weight loss with it. And so you can use, some of the supplements like Ensure or muscle milk, things like that can be useful. And then you may need to see a new nutritionist to kind of help you to stabilize your weight. Now we're going to move on to the GI symptoms, so diarrhea and constipation. So we can see either or in myeloma. If you look at most myeloma studies, a third of patients experience diarrhea and a third of patients experience constipation in most of the studies. And so it's always good to have things on hand to manage both. And so for diarrhea, we can, if you're already taking laxatives, you really want to stop that. But if you're on magnesium supplements, that can cause diarrhea. So you'd really want to talk to your provider about how can we manage your magnesium level so that you're not also getting worsening diarrhea. Sometimes antibiotics can cause some diarrhea. And then just the medications like Revlimid can cause diarrhea as well. And so you want to make sure that you're taking some anti-diarrhea medication, at least have it on hand. For Revlimid-associated diarrhea, we use something called cholestyramine or cholestyramine to help manage that, and that works really well for our patients, and that has been useful. And then for constipation, you may be on pain medicines that can cause constipation. And so making sure that you are on, a stool softener such as Miralax or Senecot S is really helpful. And you want to make sure that you're increasing your fiber intake, right? So making sure you're eating whole grains, eating fruits and vegetables, those can be really helpful. And then most importantly is making sure you're having adequate fluid intake, because if you're not drinking enough fluid, particularly water, because caffeinated coffee does not count as your fluid intake, because that's actually going to be a diuretic, making sure that you're drinking like 2 liters of water a day. So the other side effects we can see, and particularly with talquetamab, is skin and nail effects. And so you want to make sure that you're using a good lotion. So at our center, we use Vanicream, and we actually start it before the rashes start. We do that right from when we start patients on therapy, have them do it twice a day. Making sure that you're reporting any rashes to your healthcare team. And then you may need a steroid cream if the rash is getting worse. So making sure that if you do develop a rash that you're notifying your team. And then for nail changes that we can see, so at our center we have patients start using nail strengthener and vitamin E cuticle oil right when they start therapy. We don't wait till the nail changes start. So that can be helpful, and that may help with nail thinning. But you want to make sure that you're talking to your provider, because sometimes you can get like a fungal infection in your nail, and so we need to make sure that that's not what's going on. And then you want to keep your nails short and clean, and then also not wearing artificial nails, because that's not going to be good for your nails. And then what about pain? I would probably say that the majority of patients experience some sort of pain, and that could be due to peripheral neuropathy, or it could be from compression fractures or from other myeloma lesions. And so you want to make sure that we're preventing pain when possible. So we don't want you to get shingles, because shingles can cause pain. It can cause a burning sensation even after the rash has disappeared. And so making sure you're taking those medications. And then also making sure that you're, taking your pain medicine appropriately, right? So we don't want your pain to get so out of hand, right? So when your pain is starting to come up, to take something and not wait till it's really bad. We can also use something called scrambler therapy for neuropathy, particularly for patients who have painful neuropathy. We can use acupuncture, can be helpful for pain. Sometimes we do need to have patients get radiation therapy to a lytic lesion if it's causing them a significant amount of pain. And then also physical therapy can also be helpful. Peripheral neuropathy, this occurs when there's damage to the nerves, and usually it's due to some of the myeloma drugs that we use, but it also can be due to diabetes. So if you have diabetes and you're on myeloma therapy, you're kind of getting a double whammy, right? And so it can be numbness, tingling, sensitivity to touch. I usually tell my patients, I don't put a lot of descriptives on it, because I find that if I make, if you have this, this, or this, then call me. Then if they experience their neuropathy something different, then they don't call. So, you know what your hands and feet feel like, and if that changes, then call your healthcare team so that they can better assess if you're beginning to having neuropathy. And so as far as prevention, so now we use bortezomib sub-Q. So when I first started, we gave it IV. Now we use sub-Q because there's less neuropathy with it. You can use vitamin B complex vitamins to help minimize that. But if you do have neuropathy, you want to make sure that your home environment is safe. So because you could easily trip, because your ability to feel the floor underneath you is going to be impacted. And so you want to get rid of throw rugs, things like that, so that you don't trip on that. And then the other important thing is it may impact your ability to sense temperature. And so if you're going to get into the bathtub or the shower, you can't sense temperature with your hands, and so now you're trying to test the temperature and you don't even realize it's hot, right? Because you can't sense it. And so using, like, if your elbow, kind of like when you have, babies and they tell you, like, when you're going to test the water in the bathtub to use your elbow and not your hand, same kind of thing, because you want to make sure that you don't burn yourself. If you do have neuropathy, again, make sure that you're letting your team know, or if it's worsening. And then sometimes we can do physical therapy to help with the balance problems that come because of the neuropathy. We can see changes to kidney function as a result of the myeloma. And so we want to make sure that you know how to prevent further damage. So you don't want to receive any CT contrast if you have impaired kidney function, because that can actually make it worse. You want to stay hydrated, so again, drinking water. I always feel like I have to sometimes tell patients, but don't go crazy, because I've had patients, when they turn in a 24-hour urine, they turn in 5 liters of urine, and I'm like, okay, well, we could probably cut back on the fluid intake a little bit, maybe 2 liters a day. We don't have to go too crazy. So, we don't want you overhydrating, because then that can cause other problems. And then sometimes we have to dose reduce your medications for your kidney function. But most importantly, if the kidney function is up due to your myeloma, we need to treat your myeloma, and we need to be aggressive with treating your myeloma at that time. And then sometimes some patients do require dialysis because their kidney function is to the point that now the potassium is becoming too high or the phosphorus is becoming too high. And so in those cases, we do sometimes have to do dialysis. Other supportive care that medications that you may be on, so we want to prevent blood clots. So when we combine certain medications together, it can place you at risk for a clot. And the biggest thing with those clots is we don't want the clot to go to your lung, because that can be life-threatening. So you may be on blood thinners such as aspirin or a medication called Eliquis or Xarelto. You can use compression stockings, but what's really important is activity. You want to be active, you want to be up moving around, because the more immobile you are, the more that places you at risk for a blood clot. You may be on medications for your bone health, such as the bone strengthening medications. You'll likely be on calcium, vitamin D, and then physical therapy. And again, what's important for bone health, we all know this, particularly us women who get osteoporosis as we get older, right, is going to be weight-bearing activities, right? So don't forget about your arms. Everybody seems to focus on the legs, but don't forget about your arms. And you don't have to lift a lot of weight. 5-10 pounds is really all you need to help with your bone density. Then for fatigue, the biggest thing with fatigue is we want to make sure that you aren't experiencing depression. When you're diagnosed with myeloma, it feels like you're being hit by a freight train, right? It just came out of left field, and it really threw your whole life for a loop. And one of the main symptoms of depression is fatigue, and so we really want to make sure that that's not causing it. Sometimes we do blood transfusions, and then again, the biggest thing that you can do for fatigue is activity. There's a theme going on. And then for anxiety, we put you on steroids, right? And the steroids can make you feel anxious in and of itself, let alone dealing with the uncertainty of having myeloma. Also can increase your anxiety. And so sometimes, you can do some relaxation or meditation, going for counseling, but sometimes, honestly, we just have to, you have to go on a medication to help with it, and that's okay. One thing I like to reiterate to patients is if I told you that steroids was increasing your glucose level, you would not tell your provider that you are just going to get your mind to overcome the glucose not going up, right? You wouldn't do that. But what do we do with anxiety and depression? I'm just going to think myself into a better place with my mind, and I'm going to overcome my depression and my anxiety, right? And sometimes that's just not possible because, one, we are giving you a medication that makes you feel that way, right? And so there shouldn't be any shame if you need to go on an antidepressant or an anti-anxiety to help you get through that. So we talked about fatigue. So we're going to be looking, are you anemic? Are you having pain? Is it from treatment? And what can we do to help minimize that? Anxiety occurs in over 35% of patients, and depression is at least a quarter. I'd probably actually say it's probably actually more. And so don't let your fear of people judging you get in the way of asking for help. In our society, there's a stigma. Somehow we separate our brain from the rest of our bodies, but that's just not the case. Care partners are vital for success, and so they can help with managing medications, they can help with physical assistance, they can help with knowledge of myeloma because they may be able to, when they're listening to you during the appointment, they may be picking up on things. They can help with financial decisions, and they can just be your advocate, right? And so it's so important, and it doesn't just have to be any one person. My cousin was diagnosed with ovarian cancer last year, and she's single, and she has this whole network of her friends that she kind of collected, and they were called Kirsten's Angels. And they were just different people that she could call on to help with appointments and help her get groceries and things like that when she was having a bad day. So it doesn't just have to be one person. It can be a group of people to help take care of you. And it's also important that caregivers take care of themselves. Caregiving is really tough. It's stressful. And it's important that as a caregiver that you're taking care of your own health as well, making sure that you're staying up to date and seeing your doctors and getting your cancer screening testing done. And so it's just really, really vital that you take care of yourself. And the IMF has resources to help care partners. And as I mentioned, you can cultivate a care network. And so, we know that increased longevity, it improves adherence, there's lower risk of cardiovascular disease, there's improved mood, it reduces stress. And so making sure that you're making those connections with your friends and your family is really, really vital. Even joining a support group can be helpful. And so my last few slides, so making sure that you're seeing your primary care doctor and getting your recommended health screening, so making sure you're up to date on your blood pressure, diabetes, colonoscopy, mammogram, prostate, getting your vision and hearing checked, those are all really, really important. Making sure that you're getting regular activity, that you quit smoking if you smoke, and that you get sufficient amount of sleep. And so sleep is really important. We know that disturbed sleep can cause increased heart-related death, it increases anxiety, and there's lots of things that can interfere, particularly steroids, and then if there's a lot of fear, anxiety, and stress. And so things to avoid before you go to bed, caffeine, nicotine, not eating large meals, and then computer screen time. Although I have to say, I am so guilty of that, and then I'm like, why can't I sleep? And sometimes you may need a sleep aid. And there's a lot of resources out there for you as patients as far as helping you to understand your treatment, understanding the side effects with treatment, and then also what you can do to help manage your side effects. And just know that you are not alone.